Hi, my name is Alyssa Schilling, and this is my patient, John Doe. He's preparing to have surgery, so this is my Nurs305 educational video on postoperative pneumonia. So first off, what is postoperative pneumonia? That is either a bacterial or a viral infection that occurs in your lungs. Your lungs are encapsulated in millions of little alveoli, which are air-filled sacs. Outside of those sacs are capillaries, which help with gas exchange between oxygen and carbon dioxide. Patients that have pneumonia have impaired gas exchange because the alveoli become inflamed and swollen, and that decreases the exchange between the oxygen and the carbon dioxide. Oftentimes, very young patients are at risk for this, as well as those who have a history of breathing problems and those over the age of 65. So what are some risk factors? Obviously, the older you are, the higher rate of post-op pneumonia that you have. If you have a history of respiratory infections such as COPD or asthma or any of those in individuals who are immunocompromised. What are some signs and symptoms of pneumonia? Oftentimes, individuals can have a cough that can be either productive or non-productive. They could have shortness of breath, pain with coughing and deep breathing, as well as a fast heart rate at times. How is pneumonia diagnosed? Pneumonia is diagnosed with either a chest x-ray, or they can get a lab called a CBC, and that would show an elevated white blood cell count. So now we're going to focus on ways to prevent postoperative pneumonia. This is where my demonstration is going to come in play. I'm going to educate John Doe here on the incentive spirometer. So this is the incentive spirometer. I'm going to give that to you. What I want you to do is I want you to take a nice, slow, deep breath in, and I want you to hold it when you can't breathe in anymore. To make sure that you're using it properly, I want you to keep this knob between those two arrows. So go ahead and do 2 breaths for me. Good job. All right, let it go the whole way down. Whenever you're using the incentive spirometer, you do want to make sure that you're taking 10 breaths on it per hour. You also want to make sure that you let the blue knob go the entire way down to the bottom before you go ahead and take another breath. Go ahead. Good job. As you can see, he tried to hold it as much as he could, and that makes sure that you're breathing in and you're holding it there, and that means that you're using it properly. Now, if he were to be at the hospital room or even at home, and one way that he can make sure that he's using it as many times as he's supposed to is if he's watching TV, do 2 or 3 breaths every commercial, and that'll mean that he's getting the 10 in that he needs to every hour. Other ways to prevent post-op pneumonia include coughing and deep breathing, as well as if you feel like you're getting sick or you might have been diagnosed with pneumonia and you're going to cough, make sure you bring your elbow in front of your face or cough or sneeze into your elbow, and that reduces the risk of the germs being spread. It's also important to ambulate as soon as you can after you've had surgery, as well as ensuring that you're using proper hand hygiene as well as hand sanitizing. So what are some treatment options for individuals who might have postoperative pneumonia? First off, antibiotics are often prescribed to individuals who have this. They can be either oral antibiotics or IV antibiotics. Oral antibiotics you're typically on for 5 to 7 days, and you want to make sure that you finish the entire dose even if you begin to feel better. Oftentimes, you will start to feel better 3 to 5 days after you start taking the antibiotics. Just make sure that you finish the entire dose that was prescribed for you. IV antibiotics are also an option depending on the severity of the case. That would require hospitalization. Individuals may also need oxygen therapy as well. Due to the impaired gas exchange, sometimes individuals may need temporary oxygen where they normally do not wear oxygen at home. In the hospital, we try and keep patients that are greater than 92%. We titrate them based on what their oxygen needs are. Other options include breathing treatments for shortness of breath. We normally give Xopenex or albuterol for patients that are having difficulty breathing, and that helps to open up the airways and allow for better gas exchange. Also, steroids can be used to reduce the inflammation that will also increase the oxygen saturations. I hope this presentation you have learned something, and now John Doe here is able to educate others on postoperative pneumonia and ways to reduce it. Do you have any questions?
I do not, but thank you for your time.
All right, thank you.